I'm Dr. Jaroszewski, or as most patients call me, Dr. J. I'm the director of the Pectus program at Mayo Clinic in Phoenix, Arizona. We are a specialty center focused on chest wall deformities and evaluate hundreds of Pectus patients every year. Our specialists understand Pectus and the symptoms you are experiencing. If you've been searching online, you've probably come across some of the many research papers we have published. Certainly, if you're in chat rooms or on social media, you have heard from some of my patients. Pectus is the most common chest wall deformity, and yet it is still poorly understood by so many physicians. Often patients have been to a doctor who's just told them that their Pectus was just cosmetic, and yet they are struggling with symptoms of chest pain, palpitations, and progressive shortness of breath, and the loss of their ability to do any endurance exercise. We offer a comprehensive workup of patients of all ages that have chest wall deformities. This includes specialized testing designed to assess whether the Pectus is affecting you. Based on this evaluation, together, we will discuss whether surgery would be the right choice for you. We are here to educate and guide you. I think that you would probably hear from most of my patients' testimony that it was well worth the wait. In this video, we will walk you through what to expect from a consultation with Dr. J.
When you reach out to us to schedule an appointment with Dr. Jaroszewski, we do our best to get you seen as soon as possible. Although we have a long wait list, we keep it well organized and get patients in as soon as we can. You can expect a call from our office to schedule your appointment in about 3 to 4 months. You will be scheduled for multiple appointments that should be done prior to your appointment with Dr. Jaroszewski as part of the necessary workup for Pectus.
Getting a consultation to see me might be a frustrating experience, I know. I am only one person, and when I see you, it isn't just for 5 minutes. Each patient gets a comprehensive evaluation and a workup, and I spend valuable time in that consultation with you.
Our approach to testing is unique. Mayo Clinic's testing is specifically done to show how the Pectus deformity is affecting you, not trying to show there isn't anything wrong with you. We understand most patients travel to see us, so we do our best to schedule testing as close to the consult date and time as possible. This will minimize the amount of time you are here at Mayo Clinic. Typically plan to be here at least 3 to 4 days. The time waiting is a reflection of the dedicated, personalized care each patient receives here. We take pride in understanding every individual who walks through our door. The wait may seem long, but it's worth it for the best.
After you get an appointment to see Dr. Jaroszewski, our specialized nursing team will be the first to reach out to you and start the process of getting that initial information regarding you and your Pectus and how it affects your health. We talk about your symptoms and how it's affecting your life. We also go through all the testing that Dr. Jaroszewski requires as part of your consultation.
You may be scheduled with other consultants or appointments depending on individual symptoms and medical history. An example would be a cardiologist or a geneticist for history of Marfan's or familial connective tissue disorders. Each patient is unique, and we do our best to ensure that this is a comprehensive workup, and we work hard not to miss anything that would be important towards treating you and making the best decisions in your care.
We do prefer that our patients do as much of the testing here at Mayo Clinic as possible, given our specific Pectus protocols that were developed especially for evaluating Pectus. We also may need to repeat testing if it isn't done as needed at another facility, and sometimes insurance will not cover repeated testing. The evaluation you have helps Dr. Jaroszewski assess your deformity and how it affects you. Based on this information, she will discuss with you if surgery might be appropriate. It's also necessary for some insurance companies to provide approval to pay for surgery. Now, let's walk through some of the testing you are likely to have scheduled for your workup.
Hello. Here at Mayo Clinic, we perform CT scans for Pectus patients. The CT gives the best images of bones and allows Dr. J to assess the calcium in cartilage and estimates the risk of fractures and the level of difficulty moving the chest in surgery. The scans are done in a protocol to minimize radiation exposure. Unlike most CT scans which are done, which only capture images while you're breathing in, we do imaging while exhaling or breathing out. This lets us see how your chest changes with each breath, and it's important because pectus deformities usually worsen when you breathe out. We also do specialized measurements. The Haller index is one of the best known pectus index, but it is only a ratio and can be inaccurate for some patients. The correction index is a better way to assess chest pectus severity. Cardiac compression can also be measured, as well as asymmetry and various others. Often, when CT scans are done elsewhere, they don't have the details and images we prefer here for surgery.
In pectus excavatum, the primary issue is the compression of the heart by the deformity. This occurs mainly on the right heart chambers, as those are the ones located more anteriorly. The ability of the heart to improve the blood flow or the stroke volume is decreased in some patients because of the compression. We do several tests specially designed for pectus patients. The transthoracic echo is a standard test, even though it is often read as normal in pectus excavatum because it is harder to get the usual views needed to completely visualize decompression in these patients. To better understand the effects of the cardiac compression, we have the patient sit up, lean forward, and use changes in position to better evaluate stroke volume, as the severity and the location of the cardiovascular compression can vary with positional changes. We can also look at the right heart function and strain imaging, which is a measure of the loss of efficiency of the heart due to the cardiac distortion. The ECG, which measures the magnitude and the direction of the electrical activity of your heart, while normal in most cases, can show right bundle branch block and some other electrical findings consistent with heart rotation and distortion. So we also want to evaluate and document this. Cardiopulmonary exercise testing, or CPET, is probably one of our more useful tools. It shows us how your heart, lungs, and muscles work during exercise. It's like an exercise challenge. You will exercise for about 10 to 15 minutes while we monitor your breathing, blood pressure, heart rate, oxygen level, and the electrical activity of your heart. Many pectus patients can manage daily activities, but during exercise or activities that require endurance, they often feel limited, so they cannot keep up with their peers. This test lets us evaluate those specific limits and give us objective data to compare to what you are feeling.
Shortness of breath is a common symptom of many pectus patients, although most pectus patients will have normal lung function. So why are so many of you diagnosed with asthma or prescribed inhalers? That's where pulmonary function testing comes in. During pulmonary function testing, you will perform different breathing maneuvers into an apparatus that will measure your airflow, lung volumes, and your ability to transfer oxygen from your lungs to your blood. These tests help us accurately assess whether your lungs have a problem or not. It's common for us to see patients who've been misdiagnosed for years, and these tests help us clear up any confusion. These tests are quick. They usually take about an hour. If you're having pulmonary function testing, you may have a lot of questions, and we're here to help guide you through the process. For more details about the test, feel free to refer to the additional video linked, which goes into a deeper explanation of the test.
For some patients, dizziness and a racing heart is a common symptom. It is important to know whether there are abnormalities from your nervous system that could be contributing to this. At Mayo Clinic, we have an experience lab for autonomic testing, which helps us accurately assess how well your nervous system is controlling functions like heart rate, blood pressure, and sweating. Autonomic reflex screening, or ARS, is a non-invasive test that monitors these responses to various body changes. These include such things as a tilt table test, deep breathing, and the Valsalva maneuver to see how your body regulates these functions. Although this test doesn't help make surgical decisions, it is helpful for ruling out other medical conditions. It is important to look at any other factors that would be affecting your health. One condition we keep an eye out for is postural orthostatic tachycardia syndrome, or POTS. POTS can cause symptoms like pectus excavatum, including dizziness and elevated heart rate. For patients with POTS, surgery for their pectus improves some of these symptoms, but they may not go away completely. For more details about the test, feel free to refer to the additional video link.
Each patient will be scheduled with a consultation to see physical therapy. Many patients with pectus develop poor posture with their shoulders slumped forward and a rounded back. After pectus repair, it is not uncommon to have back spasm and pain due to the changes in alignment. That's why we focus on improving your posture before surgery. The better your posture is going into the procedure, the less your body will need to adjust afterward. Your posture will also help the bars in their chest remodeling because a good posture won't put opposing forces on the bars. We spend about an hour with you assessing your functional impairment and ways to improve your outcomes. To help in stretching the front of your chest and strengthening your back muscles, we use foam rollers, resistance bands, and other tools. A strong back will help support your chest and posture and ease the recovery process.
When you come for your consultation with Dr. Jaroszewski, we will also be spending about an hour reviewing information and going through more specifics. During that time, we will discuss more details about your health history and the details of surgery. We will also discuss logistics of surgery, such as how long you might plan to be in Arizona, expectations for recovery and return to work, etc. This will give you more information about the visit to Arizona and potential surgery information. That way, you can make an informed decision if surgery is right for you.
Here's what one of our patients had to say about their journey. Who better to tell you about the experience than someone who's been through it?
She just didn't question me. And she looked at my CT scan and she said, "I don't know how you've been living like this." And I've never felt so validated. The care that I received the last time that I was here was tremendous. And I mentioned to her at the time that I'd always really wanted to be able to run. And I'd never really been able to. I'd never run a mile in my whole life. One of my most traumatic childhood memories was being asked to run a mile in school and just ending up having to walk half of it. And it was, anyway. She looked at me and she said, "Oh, you're gonna be able to run." And I held on to that.
When we meet, our time will be dedicated to understanding how pectus is affecting you and impacting your life, and we will work together to discuss what is the best plan for your treatment. If you're ready to take steps to manage your symptoms and improve your quality of life, please don't hesitate to reach out to us.